Hello and welcome to Healthline. My name is Alex Colagnamos and I'm filling in for our friend Gregory Zarian for a very important discussion on women's health, specifically on hysterectomies. We're joined today by Dr. Raffi Chalian. And doctor, before we get started with our conversation, I just wanted to review some really interesting facts. According to a September 2018 report by the Centers for Disease Control and Prevention, there are approximately 600,000 hysterectomies performed each year in the States. This is the second most common major surgery among women here in the USA. So my first question to you is, please tell us a little bit about your background and where you went to school.
So I started my medical school at Imperial College in London, and I moved over to the United States to do my postgraduate training at the University of Pennsylvania.
UPenn, cool.
Yeah, it was a great experience, and then after spending several years in Philadelphia as a faculty at the local universities, I decided to relocate to the West Coast where a lot of my family is. So I have a lot of family ties here.
Very nice, very nice. And so your area of emphasis as a doctor is oncology, and how does that relate to hysterectomies and women really encouraging women to really make sure that they're taking care of their health, and if this is a procedure that they need, that they absolutely pursue it?
So my specialty is I'm dual trained. I'm both a gynecologist and a gynecologic oncologist. So that makes me both a general surgeon, a medical oncologist, and a gynecologist. And so our role in women's health is to do complicated gynecologic surgeries and to provide care for women with cancer.
So let's ask the number one question. What is a hysterectomy?
So a hysterectomy is one of the most common procedures that we do. It is a surgical procedure, and it can be done in a variety of ways. And it's surgically removing the uterus with or without the cervix, tubes, and ovaries as well.
And why is a hysterectomy done?
So there's multiple reasons why people can have a hysterectomy. One of the most common reasons is fibroids, which is very common in women, can be up to 50% in certain populations by the age of 50. You can have a hysterectomy for abnormal bleeding, endometriosis, pelvic pain.
What is endometriosis? If you can talk about that a little bit.
Yeah, endometriosis is a very common condition. It's a condition which many women have, and it is basically when the lining of the uterus leaves the uterus and seeds itself within the gynecological organs or the pelvis. And what endometriosis does is it causes pain. It causes chronic pelvic pain and can be very debilitating. And the variation of the debilitation can be very variable from person to person.
If you're dealing with any of these issues, it's so important that you take advantage of this information that Dr. Chalian is sharing with us. You know, for routine and specialized gynecological care, you can visit the experts at Adventist Health Glendale. They provide traditional as well as cutting-edge procedures for common ailments related to these very issues that we're here to discuss today. So another question we had are what are the structures that are removed when you have a hysterectomy?
So there's different types of hysterectomies you can have, but the most common structures that are removed are the uterus, the uterine cervix, the left and right fallopian tubes, and the ovaries.
What are some of the changes that a woman experiences when these organs are removed?
So there's kind of the short-term symptom issues that people can have after surgery, and then there's the long-term effects. Those can vary from person to person. If the woman is a little bit younger, then we try to leave the ovaries behind so that they have they do not have a hormonal shock to the system. That's not exactly what happens, but that's kind of a way to emphasize it. And it depends on the age of the woman at which you do the hysterectomy. In the older women, the ovaries produce less hormones, and so there's yet less of a hormonal issue associated with it.
Is this sort of like, you know, they say for men to start getting your prostate examined, you have to start at age 40 or 45. Is there an age bracket that you like women to begin coming in for this test, or is it something they just experience pain and then they would come in? How does that work?
So the way we kind of look at women's health is, you know, a women's life is very dynamic from a reproductive perspective. So we always recommend annual gynecological examinations, and then if there's any additional symptoms, they should talk to their gynecologists or call up their doctors to kind of take it up to a second level of testing, you know.
That's right. So really, I mean, you know, if I was a young woman, 17, 18 years old, if I did not already have a gynecologist, I could reach out to Adventist and look for the experts there and make an appointment and come in and just start my annual visit, right? That's how it works.
Absolutely.
Simple as that.
Absolutely. There's multiple subspecialties at Adventist Health, both general gynecology and the subspecialty services. We'd be happy to take care of you.
So going back to the age, because I'm so curious, how do you address a hysterectomy for a woman who's, let's say, in her 20s or 30s versus a woman who's in her 50s or 60s?
So I think there's a couple of things. We try to be as conservative as possible the younger the woman is, to kind of give them the option to have a reproductive capacity throughout their life. And the counseling really varies based on whether they're pre or postmenopausal and depending on the ailment that they're suffering from. So that's a very broad question, which is usually kind of very individualized.
Understood.
We have to,
yeah.
We have to make sure that we are completely, we look at the whole health of the person before we embark on any sort of surgical procedures.
How is the procedure done? Are there different ways to approach, I guess, based on a person's age or?
There's multiple ways to do a hysterectomy as well. My expertise is minimally invasive surgery, where you do it through small incisions, both robotically, laparoscopically. But depending on the case and the condition that you're doing it, it can be done through an open procedure, vaginal procedure, or laparoscopically.
And what are the different ways that you prepare for this surgery?
We usually counsel the patients beforehand. You have to be kind of emotionally prepared for it by kind of the consultations that we have. We talk in depth about what to expect, and then afterwards it's usually very easy. It's not a lot of stuff, just nothing, just some perioperative instructions we give them beforehand.
Excellent. Well, when we come back, we'll continue our conversation with Dr. Chalian. Please stay tuned. We'll be right back. Welcome back to Healthline. So some really interesting facts to share with you about Adventist. Adventist Health Glendale has been recognized by U.S. News and World Report as one of the best hospitals for the 2018-2019 year, ranking 15 out of 133 hospitals in Los Angeles and 28 out of 414 hospitals in all of California. So those are some really amazing statistics. You're in very good hands when you're at Adventist. And we are joined by Dr. Raffi Chalian. We're speaking about hysterectomies. We've had a really interesting conversation about what hysterectomies are. And a question that I had is, are there alternatives to hysterectomy surgery that, the forefront of science? Is it always going to be a case of having to remove the uterus?
No, of course. Every single one of, we look after every person individually. So depending on what their condition is, we will try our best, if they desire fertility, to maintain fertility. And if they decide to forego fertility, we can perform a hysterectomy. So that's a very broad question. There's multiple medical ways to treat some of these ailments. There's lifestyle modifications, diet, nutrition as well. So there's many ways to take care of different conditions. Not every condition is going to end up as a hysterectomy.
When you find someone, let's say, who's been dealing with the pain, and maybe they're coming to you a little later than they should, is it something that can be cured through, like you were saying, diet or lifestyle choices? I mean, what are some of those things that you recommend? So
there's it all depends. It all depends on the severity of the disease. Sometimes you can take birth control pills. Sometimes you can have an injection to put you into artificial menopause. there's multiple avenues to it. There's also the lifestyle modifications, there's stress reduction, there's pelvic physiotherapy. There's multiple avenues that you can use. This is a very broad question, so I can't really address it specifically.
Well, I can make it really specific because when my grandmother had her hysterectomy, I remember it being quite an emotional toll on the family, but that was like 40 years ago. And there's been so many amazing advancements. And I think the critical thing is to really stay on top of your health. So the diet, and you can speak to that, please, you know, the diet and what kind of foods we need to be eating and what kind of foods we need to be staying away from. It's so important that people hear that over and over again, as well as the exercise, don't smoke. I mean, all of these things contribute.
Absolutely. So let me kind of, I want to backtrack to the first part of your comment. Yes, you know, hysterectomies used to have a huge toll. When I first started in medical school in 1997, I went on clinical rotations. Women used to come into hospital with a small bag in their hand. You know, they used to pack for 5 to 7 days. Well, now what we've done is, you know, fast forward 20 years, 80% of hysterectomies are minimally invasive. You know, so these people come in one day and they go home with the same clothes on their back the next day within 24 hours. It's considered an outpatient procedure.
So what is minimally invasive? What does that mean?
Minimally invasive is the same procedure that you do open, but it's done through small little incisions and with instrumentations. So the way it works is it's like a tool to do the same procedure you would do open, but you would do minimally invasively.
So really there is no hospitalization. I mean, generally speaking, it's very brief.
We try, it's 23 hours, it's less than 23
Less than a
hours.
day, wow.
Less than 24 hours. It's called a 23-hour stay, as we call it.
And so once they're home, what is the recovery time?
It's fantastic. You know, in the olden days, they used to spend 5 to 7 days in the hospital. Now they go home, usually they can go up, they can do everything that they want to do. You know, there are some restrictions which we go over prior to their discharge, but their quality of life is really good within you know, 2 weeks after surgery.
And what about medications?
Medications, you know, about 30% of people do not need any pain medications afterwards. They take just over-the-counter Tylenol or Motrin or any of those medications. A few people will need some pain medications for a period of time, but it's very small and decreased amount.
And what about resources for family members, husbands or you know, children or anything like that? Is there any sort of counseling needed to support the family when the matriarch of the family deals with this issue?
Absolutely. You know, we use the kind of the American colleges paperwork, you know, pamphlets. We give them to people who need them, but because, you know, it's such a short in and out procedure, people cope with it very well. It's not really a huge life-changing post-operative event.
Yeah, it sounds like they're in amazing hands when they come to Adventist because not only of the medical advancements, but just your experience with having dealt with this issue. So is there anything else that a woman, let's say a woman, she's in her late 30s, she's never been pregnant, and she'll experience pain. Let's say it's between her annual doctor's visits. Could the pain be that sudden that leads to a situation where someone would need a hysterectomy?
Oh, absolutely.
Really?
Absolutely. You could, you know, what would happen is, you know, depending on their pain symptoms and how acute they are, they could either go to their primary care doctors, gynecologists, or go straight to the emergency room if it's that severe. And what we will do is we'll do the appropriate workup to see what the cause is and see whether surgery is an option for them or not. And then at that point, we can kind of tailor the therapy to the patient's desires and what is best for her medically.
And I know we talked about this a little bit in the previous segment, but what's a situation where surgery would not be necessary?
So if surgery is not necessary, if the pain is not very debilitating, if it's very short-lived, if it goes away, it's controlled with oral pain medications, those are all situations which can be managed as an outpatient, and really they don't need hospitalization or surgery.
Well, if you're not already following Adventist on Twitter and Facebook, I just wanted to review the handles so all of you who are connected on your cell phones can get updates and get a lot of amazing information through social media. You can follow Adventist on Facebook, and that handle is AH Glendale. You can follow them on Twitter, which is @Adventist Health. And you can connect with them on LinkedIn and by just looking at Adventist Health. And of course, visit our website, adventisthealthglendale.org. Please stay with us. We'll be right back after this break and continue our conversation with Dr. Chalian. Welcome back to Healthline. We're joined today by Dr. Chalian. Dr. Chalian, tell us, what are the most common cancers in women?
So gynecological cancers are actually, they're not the top cancers, but they're quite common in society. And the most common gynecological cancer that women get is uterine cancer. Uterine cancer, cervical, ovarian cancer, and cervical cancer. Those are kind of the area of expertise of a gynecological oncologist.
Mm-hmm.
We can, annual examinations are very important. Gynecological annual examinations where people are getting their pap smears as directed by their doctors. Those should be, people should adhere to those guidelines because it can stop the risk of getting advanced or cervical cancer in the future.
And that's annually?
No, it's not. So the guidelines have changed because the type of testing that we do has become more accurate.
Mm-hmm.
And this has kind of evolved over the past decade. And what we've done is we've incorporated HPV testing with pap testing. And that makes the testing much more accurate and sensitive. And so women don't have to do it every year, but they have to do it at the interval at which their doctor tells them to, and they must adhere to that. That is critical. Because it's become more sensitive and done less frequently.
I see.
If it's not done at the interval at which it's supposed to be done, the chance of missing something can be higher.
So could you tell us a little bit what those intervals are or what those time frames are? Does this depend on age?
It depends on age.
Mm-hmm.
So 21 to 29, it's every 3 years. And then from 30 to age 65, every 5 years. And if the pap tests have been normal after age 65, they do not need any additional pap testing. If they have been normal. I want to highlight that.
Sure.
You know, if you haven't had a pap test for 20 years and you're above 65, you still need to be tested.
Sure, sure. And what about some of the other kind of tests that women should be having?
Women should be having annual mammograms after the age of 50 and every other year from 40 to 50 per the ACS guidelines. You know, they should also consult their gynecologist if they have any postmenopausal bleeding, pelvic pain, or pressure, which is unusual to them.
Okay, so then in that same regard, how does this fit into the overall wellness and health that women should be seeking? Their eating habits, their dietary habits, their medications that they take, all of that, exercise, smoking.
So you know, as a gynecologist, you have to understand that I'm a little bit biased towards reproductive health. So you know, this is a small part of the whole well-being and wellness of a person, but it's also a very important part. And the fantastic thing about women's health is that we have so many ways to stop things occurring to people if they're screened in time. Which not all other types of medicine has. So it's very important to continue what your doctor directs you to do in terms of screening.
So of course it goes without saying, I mean, this entire platform is to encourage women to really take care of themselves, like health comes first. So eating right, eating the right balance of foods, managing your stress, don't smoke, drink, if you drink in moderation. All of those things, look at the medications that you take. I mean, I think that's so important, right?
Absolutely. Diet and exercise is kind of a cornerstone of good health in our modern day and time. People, the quality of the food has become extremely good in our society. It's very safe, but we are consuming. The obesity is quite rampant. Yes. So there's certain foods which are not as good for us. And exercise is very important. We live in a very sedentary society where we get out of our house, get into a car, we drive somewhere and get back into an elevator. And diet and exercise is extremely important. And it does take a toll on reproductive health.
So what are some of those steps that a patient can take after they've had the surgery, those markers, 3 weeks, 3 months, 6 months?
We tailor those steps depending on the patient. The younger athletic, the younger athlete, the 25-year-old canoeist, has a different benchmark to reach than the 75-year-old who has arthritis.
I'm so glad to hear you say that. You know, I love it when I'm driving through the city and I see people on their power walks. They're taking that time to get up from behind their desk. As you said, we're all stuck behind our desk and sitting there, hour after hour, 8 hours a day after day, week after week. That's where a lot of these ailments can build up. So thank you for encouraging people to really take care of themselves. I mean, watching the soda intake, not smoking, sugar, all of that is so important. So in conclusion, we really want to encourage all of you to get your annual checkups and talking with your doctors like Dr. Chalian, who will encourage you to have a very healthy lifestyle, and they can create for you a specific routine that's specialized in your gynecological care. The experts at Adventist Health Glendale are really here to support you with all of that. So that said, make sure you're following Adventist on Twitter and Facebook, and visit their website. You can find out about traditional healthcare methods as well as cutting-edge procedures for common ailments related to the female reproductive system, including hysterectomy, fibroids, and many other conditions. So with that said, Dr. Chalian, thank you so much for joining us.
Thank you.
I really appreciate you being here. Remember to follow us on Facebook, Twitter, LinkedIn. Visit us at AdventistHealthGlendale.org, and we'll see you next time on Healthline.